Hi, I'm Dr. Nicole Vane, and one of the things I wanted to talk about today was if you're going to have your mercury or amalgam fillings removed, there's 10 critical questions that you ask the dentist who's going to remove your mercury. The first question you should ask your dentist is, are they trained by the Hal Huggins Protocol? Dr. Huggins was the leader in mercury removal back in the 80s, and he still has an institute that is the gold standard for the removal of amalgam fillings. Look for a certificate to make sure that the doctor has attended the training. The other thing to ask your dentist is how they go about removing them. What's their sequence? Again, if they're following the Hal Huggins Protocol, they're going to use something called a readometer. A readometer tests the electrogalvanic current that comes off of the mercury fillings. It gives off a negative or a positive charge. And there's a certain sequence with which you're supposed to have them removed in order to not disrupt your bodies with the removal. The third question that you should ask your dentist, are there any supplements they give you to provide in detoxing before or during the mercury removal? There's some critical supplements that are recommended to help boost your immunity before you have the mercury removed. Question number 4. You should ask your dentist if they're certified also by the IAOMT, which is the International Academy of Oral Medicine and Toxicology, or with the HDA, which is the Holistic Dental Association. Number 5, do they use a mercury vacuum? There's a mercury vacuum that we wheel over onto each patient's chest that helps prevent the patient from having any particles going onto their skin and any particles that can escape into the air. Number 6, does the doctor provide you with supplemental oxygen? There's a very specific mask that you use that fits over your nose and creates a seal so that none of the mercury vapors can go into your nose. The number 7 thing you should look for is, does your dentist themselves wear a mercury removal mask? Oddly enough, what's made me so passionate is that when I had my blood levels tested for mercury, my levels came back in the 95th percentile of toxicity. It's pretty scary considering, again, I'm only getting it from the environment I'm in and not from having any fillings in my mouth. Number 8, there's 2 different types of systems that your doctor should use to prevent any mercury going into the floor of your mouth. One is a dental dam, which is a rubber dam that goes around your tooth so that none can escape over the sides of the tooth. And then the IAOMT protocol also specifies that we use a special suction, it's called a cleanup suction, that goes above the rubber dam clamp so that you will not have any mercury that escapes. It'll all go into the suction. Number 9, ask your dentist what they replace the mercury fillings with. Any dentist that's had the training through any of these organizations I've mentioned will know which resin materials or porcelain materials are going to be biocompatible for you so that we're replacing a toxic material with a safe one. And question number 10, ask your dentist what they give you after the mercury removal. There's a lot of different supplements that are recommended to detox you to make sure that if any mercury has gone awry, or if you already had unknowing high levels of mercury, that's going to help purge your system through the gut and through excretion, and also drawing it out with certain binding agents to make sure that all the removal doesn't release a toxic level of mercury. Through a third-party lab, you can just have your blood drawn. We have the kits here, and you can send it off, pay the lab, and get your results back in about 2 or 3 weeks. That'll tell you if you in fact are even mercury toxic. Here at Moonlight Beach Dental, the answer to all of these 10 questions is yes.